I love that. I just love saying Nutty Jerry's alone. If you've ever been out there, it's a pretty sweet venue. Willie Nelson every hour today. And so that's it for right now. We'll get you one in the 1 o'clock hour. All right, every Wednesday right about this hour, guess what? We have what we call the Altus Health Minute, which turns into 6 or 7 minutes without a doubt. We bring in a doctor affiliated with Altus Healthcare to talk about a specific topic, something that I think is pretty relevant. We've got a really relevant one right here, and I want to bring in Dr. Shaun Holt. He is an orthopedic surgery, sports medicine. Dr. Holt, I'll tell you what, you may want to pop down here and get one of these sweet cars over here because you're a doctor. Don't you guys drive a lot of cool cars?
Well, not me particularly. I drive a truck, but I definitely plan on visiting the show, yes.
Hey, they got some cool. They got the 2014 Silverado and the GMC Sierra. It's really cool stuff. The reason you can afford, let's just say, and I'm just guessing, some really nice cars and trucks, you're very, very successful in medicine, specifically orthopedic surgery and sports medicine. You're an expert in surgeries related to the shoulders and elbows and wrists specifically. There's so much interest today in sports injuries and how to prevent them. What type of injuries and issues do you typically see in your practice, and how do you treat or prevent them?
Well, we see a wide range of ages at our clinic, so it really depends on the age group that you're talking about.
Okay.
Our experience ranges from the little leaguers up to the senior citizens. Mm-hmm. And, so we started seeing injuries, unfortunately, at a very, very common, early age. And early on, we see mostly overuse injuries, the youth that are involved in sports year-round, particularly the same sport. We see a lot of overuse injuries of the bones and the joints, and most of those are really just simply rest or changing sports. So those are pretty easy. As we get a little bit older, we see much more of the traumatic injuries. They're getting bigger, they're getting stronger, they're getting faster. So we see some ligament injuries in the teenage and the young population. Then as our population ages, we see much more of the rotator cuff type injuries. So how we treat them depends on obviously the problem, but we will exhaust our non-operative measures, including anti-inflammatories, injections, either steroids or platelet-rich plasma, which is their own blood, and potentiates their healing potential, and physical therapy. And ultimately, if all that fails, then sometimes surgery is required.
At what point, I want you to define getting old, because I think I'm past that point, doctor. I think I'm past the past the point. It's not as easy for me to run my 26.2 miles. Is there an, people say, their eyes start to go right when they turn 40. Is there an age typically that you see more and more, adults come in going, uh-oh, my knee's not working, my shoulder's not working?
Yeah, interestingly enough, 35 to 40 seems to be the tipping point when we start to see more kind of degenerative and wear and tear things of the rotator cuff. And, of course, that varies, but, that really seems to be where we start to see an exponentially increasing number of those type of injuries. And, unfortunately, I've seen them younger and younger. I'm not sure exactly what's going on with that, if it's a nutritional thing, if it's an activity, lifestyle type thing, but it seems that we're seeing them in younger and younger populations.
Dr. Shaun Holt joining us. He is with Altus Healthcare, with the Altus Health Update. We do this every Wednesday here on the Michael Garfield program. Give me some of the advances today in orthopedic surgery. I mean, can't many procedures be done kind of outpatient setting with the little recovery time? I mean, and also maybe some tips to speedy recovery.
Correct. Yeah, you're exactly right. And I think, at least in my realm, dealing with shoulder and elbow surgery, I can say some of the advances in shoulder surgery are the ability to do things arthroscopically. In the not-too-distant past, at one point, we were just happy to be able to look inside, more of a diagnostic scope, and translate to an open surgery. And then it sort of progressed to where we can do some very basic things arthroscopically. Well, really with today's technology and with the skills that have been developed, we can do things, and I can just say beyond a shadow of a doubt, we can do things actually more efficiently and better and more anatomically correct arthroscopically than we could ever achieve in an open fashion. So I think I can say that just wholeheartedly and believe that today we can accomplish things in a much more less invasive fashion, not compromise results, in fact, actually have improved results with those.
Dr. Shaun Holt joining me here for a minute or two. It's the Altus Health Update. Not only are you a doctor, you're an author. You have a book, Beating Your Genetics. What's the premise of that?
Well, thank you for mentioning that, actually. The premise of that book is we trace the nutritional history from several hundred years ago up to our current times, and how the nutritional changes that we have gone through, particularly in our westernized societies, has directly correlated with our health problems that we see today that are just so rampant. And majority of our issues today are correctable through nutritional means. And really, when you look at our genetics and how we're programmed, I believe, to respond to our food, we're creating exactly the problems that we're seeing. So within us lies a blueprint for a very lean, healthy race. And unfortunately, the things that we do every day and the choices that we make every day are causing us to beat our own genetics. So that's really the basis of the book.
Fantastic. One question before I get you out of here for the top of the hour. You're an expert in sports medicine, one who deals with thousands and thousands of athletes yearly. A lot of parents will probably want to know this too. What advice do you give young athletes to maximize their performance?
Well, yeah, I actually get asked that probably 20 times a day.
Yeah, I bet.
And the first thing I tell parents and the kids is that there are no shortcuts. We get junk in. We put junk in. We get junk out. So the first thing we do is get them on a sound nutritional program. They have to eat correctly in order to perform correctly. That's the first thing. Second thing is they have to train like an athlete. They have to put the time in to develop their strength, their speed, their agility, and later on we can develop their sport-specific type skills. One mistake that I see, particularly in the very young, is we spend far too many hours trying to develop a sport-specific skill when really it's the whole athlete that we need to be developing, the speed, the flexibility, the agility. Those kind of things are primary early. Later on, we can learn the skill development. So I just think we need to reshift our focus and put good things in the body.
Gotcha. Real quickly, how about the website and your phone number if anybody wants to reach out?
It is www.allamericanorthopedics.com. Phone number is 281-335-1111.
Dr. Shaun Holt, the Altus Health Minute. Thank you so much for joining us. I may see you soon, at least with my little sons who play football.
I appreciate it.
Have a great day. Check us out on the other side from the Houston Auto Show. So much more. You're not going to want to miss these interviews. It's Michael Garfield coming